This session we will be learning about time and stress management from the nurse manager's perspective. The objectives for this session are to assess the manager's role in helping staff manage stress and evaluate common barriers to effective time management. We are going to focus on three elements of managing time and stress. Quickly, we will review the signs of stress. I know you all know them, but often we get so focused on everything we need to do that we forget to step back and assess the situation and ourselves. Next, we are going to talk briefly about some tips to avoid interruptions, things that often add to our stress. Then we are going to talk about managing stress and time. In 2008, a Harris poll showed that there were considerable issues related to stress. These included fear, anxiety, physical ailments, and personal and emotional problems. Many of these issues resulted in accidents, absenteeism, turnover, diminished productivity, and increased costs of insurances. In 2006, Tanbrief found that stress resulted in these percentages and negative employment situations. Although each of us might respond differently to stressors, there are some workplace factors that many of us respond to. Pettigrew says that there are two ways to look at job-related stressors. Some are external. These are the conditions themselves, such as workload shifts, high patient acuity, workplace changes, ethical conflicts, job insecurity, and role ambiguity. The nurse experienced role ambiguity when his or her role expectations are currently unclear because of the added managerial role. Internal sources are those things we bring with us, problems at home or at school, challenges of getting to and from work, negative self-talk, lack of social support, inability to make decisions, and pessimistic thinking. These all contribute to or are responses to stress. Not every headache is due to stress, and feeling tired is a logical result of working hard. Yet both of these can be subtle signs of stress. Also, when you or a coworker repeatedly says, "I don't care, you decide," unless the decision is truly inconsequential, this may be a sign of stress. While we cannot eliminate stress, nor do we totally want to, we can manage how we experience stress, what we do in response to stress, and our time and the choices we make. Stress prevention is the key, and it starts with choosing the right place to work. If you've had a bad experience during a clinical situation, there is no need to decide to work there to overcome this experience. Move on. Figure out what the daily stressors are and then try to space them out, avoid them, or find new ways to respond to them. Don't forget about physical stress that is just as damaging as psychological stress. Insist on equipment in the workplace that helps you do the work in a correct and timely manner and prevents injuries. Time in addition to the tried and true tip about eating right, here are some other things to think about. Each of these can help us respond in a more positive manner when faced with stressful situations. We can also seek assistance through counseling and employee assistance programs. These are the top 5 stress management mistakes. Do any of these relate to you? Let's look for a bit at the first one, poor calendar habits. If we think of calendar management in the broadest sense, it really refers to managing the time we have in life to achieve what we want. Whether we are discussing calendars or schedules or hours or minutes, the key is that time easily escapes us. Ask yourself these questions. Where does your time go? Are you doing too much? Are you able to say no? Do you procrastinate? Do you spend time complaining rather than acting? First, however, ask yourself, is it your job? Interruptions. We're going to talk about interruptions. And you need to ask yourself if it is your job to be interrupted. If it is and it causes you stress, you need to find different work or change how you think about interruptions. Being organized doesn't prevent interruption, but they can often be accommodated. If you aren't organized, the smallest interruption can become a disaster. Be sure to use delegation to maximize your effectiveness. Know what needs to be reported back and be clear at the onset how you will keep apprised of changes in a patient's status. Multiple things happen at once in clinical settings, so setting priorities and focusing on those things keep you goal-oriented. Whether you use an electronic device or a piece of paper, use some kind of method for tracking your own time. Sometimes when we are immersed in a situation, we lose all track of time and then aren't sure what we need to do next. If someone wants to give you information, unless it is in response to a question you ask them to write it down and give it to you. When we become really busy, we may forget the information that wasn't related to the situation at hand. Remember that everyone has only 24 hours a day to live life. Successful people know how to use that time effectively for themselves, their careers, their loved ones, and their work.